Hi, my name is Ed, and today I'm going to be doing medication administration. Right now, I'm in the medication room, and I'm going to be pulling out all my supplies, the medicines that the doctor ordered for my patient, Mr. Gray Bunny. Before I do anything, I'm going to go ahead and do some hand hygiene. All right, and then I'm gonna log. Before I start, I'm just gonna mention the 10 rights of medication. The first one will be the right medication, the right dose, the right patient, the right route, and the right time. And at the same time, the 5 others are the right documentation, the patient's right to refuse the medication, the right assessment, which I'm going to be doing assessment to my patient later when I go to his room, the right education. I'll be doing a little bit of education for my patient as to the therapeutic effects and the adverse effects of the medication I'm giving him. And if he has any other questions too, I will try to address it myself. And evaluation, I'll do it before I give my medication and after I give my medication, just to see how patient is taking the medication I'm going to be giving him. Okay, right now I'm gonna do all my 2 checks for the medications that I'm gonna be taking out. I log in through the computer and open up the patient's record and see the MAR, and at the same time I log in through the system, through the medication drawer. I'm gonna pull out 1 medication at a time. I'm gonna compare it to the MAR. The first one is a pain reliever. It's acetaminophen, 500 milligram. The order is 1 tablet at 8 o'clock in the morning, PO or orally. I'm gonna have to compare it to the MAR if it's the right medication, the right dose, the right patient, the right route, and the right time. Okay, looks like it's the right one. I'm just gonna go ahead and check for the expiration date. If the medicine is still okay, check the label. Okay, I think it's good. I'm gonna go ahead and prepare the medication for my patient. So you get 1 as per doctor's order. As soon as I prepare it, I'm gonna check it again the second time. If compare it to the MAR, if it's the right medication, the right dose, the right patient, the right route, and the right time. Okay, I'm gonna go ahead and take out the second medication. Before I prepare it, I'm just gonna have to see and compare to the MAR. It's flu vaccine. It's gonna be an injectable via intramuscular injection. I'm gonna check if it's the right medication, the right dose, the right patient, the right route, and the right time. Okay, after I draw it, I'm gonna have to prepare it. By preparing it, I'm gonna check it again for the second time if it's the right medication, the right dose, the right patient, the right route, and the right time. The second medication here, and then I'm gonna go ahead and check and get the third medication that's ordered by the doctor. It's a subcutaneous injection it's an insulin injection for my patient. Now I'm gonna have to see before I prepare it and compare it to the MAR again if it's the right medication, the right dose, the right patient, the right route, and the right time. And because it's an insulin, I'm gonna have another nurse to double check on the insulin if it's the right medication for my patient and if it's the right patient and the right dose. And at the same time as we prepare it, we might as well go ahead and check for the second time if it's the right medication, the right dose, the right patient, the right route, and the right time. I think I got everything ready, and now I'm gonna go ahead and log out through the system in here and in the computer. Log out through the MAR. Okay, now I'm ready. I'm gonna go ahead and go to my patient's room. Hello.
Hello.
Hi, good morning.
Good morning.
I'm just gonna go down and put the tray close to my patient on his table. I'm gonna be your aide today. I'm gonna be your nurse today. My name is Ed. Nice to meet you.
Nice to meet you.
Okay, before I go ahead, I'm just gonna go and wash my hands really quick, do some hand hygiene, perform OA wipes. I've got all my supplies already. I'm just gonna go ahead and give you some privacy to make sure we don't expose anything, any part of your body, because we're gonna be doing giving you some injection today. Okay.
Okay.
Okay. Before I start, can I get your name and your date of birth, please?
My name is Mr. Gray Bunny, and my date of birth is January 20th, 1960.
Okay. Let me just check the wristband. Okay. All right. So today, the doctor ordered to give you some medications, and these are going to be three kinds of medication. One is an oral medication. The second will be an IM injection. It's your flu shot, and the third one is a sub-Q injection. It's your insulin. Do you have any allergy to any kinds of medication, especially these three?
No.
Oh, okay. So I see that I see that the doctor ordered a pain medication for you. Do you still have any pain right now?
Yeah, my head hurts.
Oh, I'm sorry. You remember when your headache started?
It started late last night, early in the morning hours.
How do you feel when you have your headache? I mean, can you explain to me your headache?
Yes, it's like a dull, throbbing headache.
Oh, I'm so sorry. Can you tell me what aggravates it?
When I move around a lot, it seems to get worse.
Okay, and what do you think is the alleviating factor?
Well, if I avoid bright lights and I just keep really still, it seems to get better.
Okay, so if I'll have you rate your pain right now with a 0 to 10 pain scale. 0 being no pain, 10 being excruciating pain. What level would you be?
I'm probably at a 7.
Oh, okay. So hopefully this medication will help you today, okay? Because your doctor ordered you a pain pill. I'm just gonna, before I give it to you, I'm just gonna double check it on the on your MAR, okay?
Okay.
Okay, I have here acetaminophen, 1 tablet at 8 o'clock in the morning via PO. It's 500 milligram. Okay. I'm just gonna do my third check right now while I'm in the patient's bedside. I'm gonna check if it's the right medication, the right dose, the right patient, the right route, and the right time. Okay. Before I start, let me just go ahead and wash my hands and then put on gloves, okay? Because I'm gonna be doing injections too later. Okay, I have here a cup of water and your pain pill. Are you gonna be okay to take it by yourself, or you want me to help you?
Would you help me, please?
Oh yeah, sure. Here you go. Here's the pain pill. Here's the water. Okay. Just to give you a little bit of information about the pill that you just took. So the acetaminophen should help you alleviate your pain. In a few minutes, you probably feel the effects of your pain pill. Okay?
Okay.
And then at the same time, you might feel adverse effects of the pain pill. You might feel dizzy or drowsy. So if you do feel it and you feel like it's very uncomfortable for you, just let me know, okay?
All right.
All right. Thank you very much. Now I'm gonna go ahead and do your give you your second medication, okay?
Okay.
This is gonna be an injection through your muscle, an intramuscular injection, okay? It actually is a flu vaccine. Have you ever had any flu vaccine before?
Yes, I get them every year.
Okay, and you said you didn't have any allergic reactions to it, right?
No.
Okay. Before I give it to you, I'm just gonna go ahead and check it on the computer and compare it to the MAR. If it's the right medication, the right dose, the right patient, the right route, and the right time. Okay, I think this is correct. Where do you want me to do it?
I usually get it in my left arm.
Okay, on your left arm. Okay. I'm just gonna go ahead and pull your clothes a little bit just to open up the area. We're gonna be doing the injection. And then I'm gonna go ahead and check for your skin if there's any signs of lesion, trauma, inflammation, if there's any like bony prominences, or if we can get a good amount of muscle tissue over here. I think this should be okay. In order for me to look which it's where the injection site is, I'm gonna have to go ahead and find your acromial process, and below that I should put 2 fingers or 3, and then that's where our injection site will be. Okay, I'm gonna go ahead and wipe it with antimicrobial film. Okay, I'm gonna go ahead and wipe it from the inside out for at least like 2 inches wide. While I'm letting it dry, I'm gonna prepare your injection. Okay, I'm gonna remove the cap with the injection. Okay, this is gonna just be a very quick process. Okay.
Okay.
I'm gonna go ahead. Now I'm ready to put the injection on. I'm just gonna go ahead and put a Z track method, and then just to display some tissue. All right, when you're ready, I'm gonna be putting all the medication. Okay.
Okay.
Okay. Just relax your arm. Okay.
All right.
Okay, I'm gonna go ahead and inject it via darting motion at a 90-degree angle. I'm gonna hold the syringe and stabilize it, and now I'm gonna go ahead and inject it slowly at a rate of 1 milliliter per 10 seconds. Okay, and then when I'm done, I'm gonna take it out the same angle, and then put the safety cap back on, and then dump it in the sharps container. I'm gonna go ahead and just put a cotton ball on this side just to make sure we stop bleeding if there is anything, and then I'm gonna go ahead and put a band-aid on it just to cover. Everything okay, Mr. Bunny?
Yes, thank you.
Okay, now I'm just gonna want to let you know just a little bit of information about the flu shot that you got. That should help you build antibodies to fight any flu strain that you might be getting. So hopefully you will not be getting like very bad flu. If there is, and your symptoms should not be that bad if you had the injection. And you might be getting like adverse effects of the injection that I just gave you, but a lot of the times this is just gonna be like minimal, like redness or swelling or maybe low-grade fever. If it gets worse, or if you get them, just let me know. Okay.
Okay.
All right. Okay, Mr. Bunny, we're gonna go ahead and give you a third medication. Okay, it's your insulin injection. You've had it before, right?
Yes.
Okay, you have any allergic reaction to it?
No.
Oh, okay. Now, before I give it to you, let me just check and compare it in your record right here. If it's the right medication, the right dose, the right patient, the right route, and the right time. Okay? Before I give it to you, let me help you get comfortable. Okay? I'm gonna be doing it subcutaneous. So, is it okay if I do it in your abdomen?
Sure.
Okay. Let's go ahead and get you more comfortable. I'm gonna go ahead and check your stomach. Right here, I'm gonna go assess and check for any signs of lesions, trauma, inflammation, or if I have a good amount of subcutaneous tissue right here. I think we do. Okay, before we start, I'm just gonna go ahead and wipe it with antimicrobial film, okay? From the inside out to like 2 inches wide. Okay. Okay, we'll let it dry, and then while we're letting it dry, I'm gonna just go ahead and remove the cap of the syringe. Okay, I think we're ready. Are you ready, Mr. Bunny?
Yes.
Okay, I'm gonna go ahead and pinch a portion of your stomach, okay?
Okay.
I'm gonna go ahead and do a darting motion and at 90-degree angle. Seems like my patient here has a good amount of subcutaneous tissue. All right, 1, 2, 3, just relax, okay?
All right.
1, 2, 3. I'm gonna go ahead and release my non-dominant hand and hold the syringe for stability, and do the injection slowly at a rate of 1 milliliter per 10 seconds. When I'm done, I'm gonna take the syringe out at the same angle I put it in, and then put the safety cap back on and dump it in the sharps container. I'm gonna go ahead and, without giving a massage, I'm gonna go ahead and put a cotton ball on the area, an injection shot, just to make sure we don't have any bleeding right there. Alright, I'm just gonna go ahead and put a Band-Aid in there, okay, Mr. Bunny? Okay, that's done. I'm gonna go ahead and help my patient get situated. How are you feeling?
I'm fine.
Okay, so your insulin injection should help you bring your sugar level down, okay, and regulate it.
Okay.
At the same time, you might feel any adverse reaction to it, but I'm pretty sure it's gonna be minimal because you've been having this every day, okay? But if you do, you let us know, okay?
All right.
I'll be here for a while, do all the documentation, so I'll be able to evaluate you and how you took the, how your body, how you react to the medication, the body reacts to the medication. I'm gonna go ahead and take my gloves out and dump it in the correct bin. Gather all my supplies and dump it in the correct bin as well. Wash my hands. Wash my hands and do my documentation. Right now I'm gonna be documenting all the medications that I give to my patient. I'm gonna be documenting the date, the time, the site of the injections, as well as how the patient tolerated the medication that I administered, and at the same time, what are the medications that I gave to my patient. After documenting, by looking at my patient, he looks very good. I'm just gonna go ahead and ask her if there is anything. Do you need anything, Mr. Bunny?
No, I'm fine. Thanks, Ed.
Okay, I'll gather all my supplies before I leave. I'm gonna make the patient make sure that the patient is safe by giving him the call light, the tray table close to him, any personal items that he wants to be near to him. Put the bed low, side rails up as per our facility policy, and open up the curtain. Okay, Mr. Bunny, you call me if you need anything, okay?
Thank you.
I'll be back in 30 minutes to check on you, okay?
All right.
All right, thank you.
Thank you.